Well, hello everybody. Welcome once again to another of our In Conversation series where we talk to leaders across the health and care system across the UK and beyond. And today I'm thrilled to be joined by Chris Laing, who is the Chief Executive of UCLPartners. Chris, thanks for joining us today. Ostensibly, for the next few minutes, we're going to be talking about the work of the National Innovation Accelerator programme, which you lead. But before we get there, maybe because people are always interested in this, just tell us a little bit about yourself, your day job, your background, and how you got to where you are today.
Great. Well, thanks very much for the invite and the opportunity to speak, Richard, and welcome to everyone on the podcast. So, I'm a kidney doctor by background, and I've got quite a lot of experience in in healthcare leadership at trust level. I was previously Associate Medical Director of All Free, working with Steve Powis, and I did Divisional Director at UCLH. And a lot of my background in innovation has been in kidney disease, and particularly in acute kidney failure. Very interested in innovation as a route to improving health outcomes. I joined as UCLPartners Chief Executive in February. We're a health innovation partnership spanning an academic health science centre and academic health science network, and we feel our job is to try and address some of our big health challenges through working in close partnership with our universities, industry, partners, patients, public charities, and really trying to work across the entire innovation pathway from discovery, early testing, adoption, spread, and evaluation, and trying to do that with our ICSs and local partners in a very systematic way and support that effort. We're very much focused on trying to solve big, medium to long-term health problems, particularly those that drive inequalities and outcomes. We host the NIA, which is several years on from inception now. So we oversee it, but it's a national programme. Fundamentally, we're commissioned by the Innovation Research Life Science Directorate within NHS England. That sits within the Transformation Directorate under Tim Ferriss. And my team in the NIE, which I currently lead, oversee this programme, and I've taken over from Amanda Begley in that role, who helped made a fantastic contribution founding the programme. But fundamentally, we're an accelerator of supporting some superb individuals, scaling their products and aligning them with the health needs in the NHS. But we'll probably want to talk a bit more about the NIE.
Yeah, exactly. So thanks for that, Chris. And good name check. There are some friends of the HSN, of ABHI, people working with closely, not least Steve and others, but also UCLPartners, the AHSM, which has adopted us as our local AHSM from where we are in Marylebone. So National Innovation Accelerator Programme, touched on it briefly so far. Chris, just tell us about that. What's it involved? Who's involved? How do people get involved in it? All that kind of good stuff.
So we have a core team, and we but I think it's important to realise it's something that we do as an AHSN network. So we're kind of working in very close partnership with our 15 HSNs that span England, and it's a co-production. Our chair is Steve Powis, who leads our board. I direct operation with the operational team in UCLPartners. What is it? Well, we're really trying to take established, I view it primarily as a fellowship programme. So it is about developing exceptional individuals who are innovators, but also supporting their companies and also supporting the specific innovations that are nested within their businesses. And what we're trying to do is make it easier for them to develop their businesses, that they have a professional development programme, and that their innovations go from, these are generally reasonably mature, tested innovations that have some traction in a number of hospital sites, or, for example, a provider hospital innovation, about 3 sites. We're trying to, over the course of the programme, support them with more national scaling. So we're not a marketing thing, we're developing them, advising them, allowing them to access the HSN network, and they individually provide support. There's a massive component of this is the work of our mentors. We have an exceptional group of mentors who support these individuals. And a huge amount of benefit I see is through their interactions with each other and their shared experiences and so on and so forth. So yeah, that's what we provide. There are networking events, there's access to mentors, there's the access to the HSNs themselves, is what advice we as an operational team provide. We have events where you know, we get senior leadership from within healthcare and innovation, so the fellows can pick their brains and so on and so forth. So you know, we've seen a number of innovations scale significantly nationally through the fellowship, and you know, we feel the NI has been able to make a significant contribution to their efforts. So we are very, in terms of what we are trying to achieve, we want to see health impact. We want to see the needs of the NHS met, but we also want to help make the NHS an environment for these businesses to flourish. And we want, you know, we want to see, you know, the economic benefits of these companies growing. So I think it's supporting industry, supporting the NHS, and supporting obviously the health outcomes of our population. In terms of how we select fellows, we have an annual round. I think the sort of things that we're looking at is exceptional people, good innovations, being at a certain level of development where accessing what is a national rather than a local support is appropriate. It is open to both UK-based and international innovators. I think specifically, you know, we're looking at, you know, patient and public contribution to the development of those innovations. And we are, of course, looking very closely at the health equalities impact of these innovations, not just in being assured that the innovations don't drive inequality, as some concerns technology might, but actively reducing inequality in outcomes. So they're key yardsticks by which we measure things. And obviously the values and drive and motivations of the innovators themselves. And, you know, really, is this something that would benefit them? So we're very keen to expand the NIA. There's a lot of central support for making it bigger, but we want to make sure that you know, we don't dilute our criteria and we can continue to have a very high bar for the type of things that we take on. And, you know, just to emphasise, it's very much a co-production with the other 15 HSNs.
Right, so just to clarify, Chris, the scheme is open to anybody. You don't have to be part of the NHS. It's open to innovators from anywhere, as long as they've got the credentials you outlined. Yes,
and obviously there's some commitments around time to benefit. Like many accelerators, you get out what you put in. But you know, so there is a commitment of time to seeing the programme through and so on and so forth. But yeah, we have a selection criteria, but the application process is very open. And if you access the NIA website, you can get an idea of what exactly where the bar is and who's likely to benefit and what the criteria of selection are likely to be, which obviously evolve over time.
That's great. So when this goes out, we'll make sure the necessary links are on there. Then one last question on that: your mentor program. There will be we do our own mentoring scheme actually, where some of our larger companies help the smaller ones. There will be people listening to this that have been through the program actually. Others who have been around for a while want to give something back. If someone was interested in supporting the program in that way, how would they best contact you?
Well, they could contact me directly or Susie, and there's contact details on the website. But we're absolutely very keen to increase our network of mentors who we value very highly, and I think very much enjoy being part of the programme. And it's definitely our strategic ambition to expand the programme, so we will need more mentors.
Chris, that's great, and well, we can commit here, all your friends at ABHI, to really get behind, support the programme, and spread it internationally as well. As you know, we run similar schemes in the US where we have a mentor-based programme as well. It's enormously useful, and I think it's a huge asset for us as a country, as we really want to make this the best place to come and do research and develop and distribute products in our space. Chris, that's been great, and we look forward to working with you on this programme, and of course in your work across the network, the HSN, and across the national network, with whom we have a close personal relationship. So thanks for your leadership of this programme. It's absolutely fantastic. And particularly, again, thanks for everything you do at UCLP, our local AHSN, and you've been very generous in giving us time and facilities to support some of our work. So we look forward to continuing progress in the months and years ahead. Chris, thanks very much.
Thank you, Richard. See you soon. Thank you.